We have great health care in this country, but it's uneven in its applicability to our citizens, and the complications that our seniors have to deal with, and the uncertainty. Will this be covered or will that be covered? That's something which needs to be improved and resolved. And people, no one in this country is looking for a free deal, somebody else to give them something that they don't deserve, but they want to know what the deal is. And for 20 and 30 and 40-year-olds, they want to know, what's it going to be like when I get to be a senior? Will government be there to honor its promises? And the answer to that is yes. We want to get people in the system, have them covered. And we actually found it's really less expensive to give people preventative care than to be paying for extremely complicated problems that arise down the road. So we want everybody in the system.
What happens in Massachusetts if you can't afford to buy insurance, or if you don't want insurance?
Well, that's the great thing about our plan. If you can't afford to buy insurance, we help you buy it. And so we said to people of low incomes, look at your income level, pay what you can afford, $5 a week, $10 a week, and we, the state, will pick up the rest. And the good news is, it costs us no more money to help people buy insurance than it had been costing us to give out free care in the hospitals. So it didn't cost us more money, didn't require new taxes. One of the great challenges we have is that if a drug company here works for years and years and years, and it's well over a decade to develop a drug that can be taken by a human being to cure a disease or to help a condition, it's going to cost over $1 billion to develop that drug. Now, some other countries say, we'll take that drug, but unless you give it to us for this low price, we will authorize our own drug companies to manufacture it and sell it to our citizens and not honor your patent. And that kind of pressure is what causes our drug companies to have to sell to those countries at very low prices, and then who's going to make up for the $1 billion of cost? We need to have higher standards of trade protection between our different countries. You'll honor our patents and our designs, and by virtue of doing that, we'll have a great deal more free trade between us, but we're not going to allow you to continue to take patents and not pay your fair share. And that will bring the cost of products down here, and that's something which I think is badly needed.
Governor, do you think the federal government, the Congress, could actually simplify Medicare? I mean, we've been trying to get the Tax Simplification Act for several decades now. Could we get a Medicare Simplification Act?
It's time to have some people in Washington that treat Washington a bit more like you do in the private sector, which is say, let's get the job done. If our product is old and is being held together by baling wire and duct tape, let's see if we can't update it and modernize it. I think we can do that on a bipartisan basis. This isn't talking about cutting it or changing it. It's saying, let's simplify it, make it easier for seniors to use. You can't solve the problems of Medicare and the baby boomers coming along by just trying to change the program in some way. Healthcare itself is going to have to be redesigned in some respects. And I actually think one aspect of that is that individuals who use healthcare services probably need to have a stake in what the cost and quality is of that service. So co-insurance or having people have health savings accounts, these kinds of ideas will begin to have people focus on the fact that at one facility they get better care than another, and a different facility has lower cost, and they'll be able to shop as you do for most of the goods and services we buy in our economy.